back to Doctors on TV. Mga kasambahay, ang topic natin this morning, epilepsy. Kasama pa rin natin ang Vice President ng Philippine League Against Epilepsy, Dr. Jeannie Ahoro. Good morning, Dr. So, Dr., kanina sabi niyo maraming manifestations ang epilepsy. Yes. Hindi lang nagkukumbulsyon. May mga milder forms na minsan blank stare. When should a parent or a friend be worried that yung anak niya baka may seizures disorder?
Okay. Siyempre, if something is happening that's quite unusual, no, for the child or for an adult for that matter, then siguro mas mabuti talaga magpakonsulta. But yung mga atake kasi ng epilepsy, may iba-ibang types nga yan, gaya ng sinabi natin. Meron tayo ng tinatawag na partial epilepsies, kung saan ang manifestations nito can be as simple as focal twitching ng face, no? Parang gumaganyan lang siya, or focal twitching ng kamay, na patient may be fully aware of what's happening but they cannot control it. Gaya ng na-mention ko din kanina, nang kukwentuhan tayo, it can be as simple as nagkakaamoy sila ng parang unusual sense na sila lang ang nakakaamoy.
Hindi natin naamoy.
And this can be as brief as a few seconds, no? And meron din naman tayong tinatawag yung parang gaya na mention ni JM, natutulala lang sila, no, doing their usual activities, biglang titigil, tutulala, titingin sa kawalan, then they're just back, no? Meron din namang nagkukumbulsyon. Ito yung typical na nakikita natin ngayon, nangingisay, no? Meron naman na pagkakamalang lampa kasi ang manifestation ng seizures nila, bigla lang silang bumabagsak. Loss ng tone ng katawan. Can be just the head or parang biglang buong katawan babagsak. Ito yung may mga atonic type of seizures. That's the reason why we need to put helmets on them to protect them because they can hit their head any time, no?
But the school teachers, mga teachers sa school siguro should be aware of the symptoms of epilepsy.
Because yung kagaya ng blank stares or ng absence epilepsies, no? Those patients who manifest with absence epilepsy, sila kadalasan, the reason why they're brought to our attention is kasi nagre-reklamo yung mga teacher na laging natutulala, akala nila
napapagalitan.
Yes, napapagalitan sila ng kanilang mga teachers, no? And they thought that sila rin kasi kadalasan, isa pang reason why they are being brought to us is because nagkakaroon sila ng sa school performance nila, no? Kasi paminsan what happens in the event that they have an attack. So for example, ako si teacher, nagkukwento ko, once upon a time, then the patient goes into absence, let's say, kasi it can happen in clusters, it can have several attacks in the, and then ang naririnig na lang niya sa lesson is, and they live happily ever after. So syempre, if you ask the child, ano yung gist nung or if she has to take an exam, then ano yung sasagot niya sa exam? Narinig niya lang once upon a time and they live happily ever after.
Kasi nag-seizure siya.
Kasi nag-seizure siya in between. So, ito yung mga rason why they are being brought to our attention.
Pero we see patients na nag-convulse and sabi niyo kanina, yung iba lumalayo pa, no? Ano bang first aid sa isang patient na nagko-convulsion?
Ito, marami kasi, with regards to giving first aid to persons with epilepsy, no? Kadalasan kasi ang nangyayari.
Masahe.
Well, actually, you don't need all of those. What you need to do for generalized tonic-clonic seizures, no, what you can do is, for example, na hulog siya, no, you just, unang-una is position the patient. Ano siya, lateral decubitus position,
so turn
to the side, and then put something soft under the head. Kasi syempre when they're jerking, tapos semento yon, so that's additional trauma, no? And then you just wait out the seizures.
Alright.
No? And best is to time how long the duration of the seizure will be, kung gaano siya kahaba. Okay? So kami, most of us, we inform the patients kasi nga like I mentioned earlier, the seizure can be as short as a few seconds, but it can also be prolonged. And there's such a condition we call status epilepticus, wherein the patient can go into seizures for more than 30 minutes, and this is potentially life-threatening and lethal.
Could be lethal.
So, ganun lang kasimple lang pala. Itatagilid yung pasyente.
Tatagilid mo lang siya.
Talagay mo yung unan.
Wait out the seizures. You don't need to put yung mga maling ito yung mga emphasize, maling ginagawa, no? Paglagay ng mga kutsara or paglagay yung iba yung daliri, no? No? So, pwedeng, hindi na natin ginagawa yan. Binubusan ng tubig, no? Yung iba pinapainom habang nagsisissues. Yes, exactly, doktora. So, imbis na nakatulong kayo, no? Mas lalo pang napasama. Yung iba nagsi-CPR, yung iba mouth-to-mouth. You don't do this, no? And for those patients, especially if they are not aware, with the advances of technology, malaking tulong sa amin to. If you can take a video of the attack,
no? At YouTube.
Because most of the time, actually, we don't get to see the actual seizures. So we really just rely on the description that the
few seconds
parents.
Lang eh.
But like I said, paano kung hindi sila aware, 'di ba?
Kung hindi nila ma-recognize.
So the video will definitely help us para ma-distinguish kasi yung klase ng epilepsy na meron sila. Doon din magdedepende kasi kung anong klaseng gamot ang pwede nating ibigay. Iba-iba rin kasi yan. Iba-ibang klase ng seizures, iba-ibang klaseng gamot.
So, importante pala video.
Video.
Huwag ka lang sasama. Baka sumama ka sa
wag na yung
seizure.
Wag naman selfie.
Pero Doc, before we go to the treatment, ano yung mga long-term complications or effects, lalo na sa bata, kung madalas mag-seizure?
Okay. Like I said, in 60 to 70% of patients, marami sa kanila after several years of taking medications, they can be weaned off from the medications and they can live normal lives, even if they have epilepsy. Okay? But a certain percentage, some of them, especially those associated with some form of brain injuries or malformations, from the onset sila na yung meron talagang so we see patients with cerebral palsy at the same time having epilepsy. There are patients with autistic spectrum disorders na meron ding comorbidity na epilepsy, patients with stroke na may comorbidity na epilepsy. So actually it will all depend on what kind of epilepsy they have at saka ano yung other comorbidities.
So how would you know if someone is faking a seizure?
Pseudo-seizures na sinasabi natin.
Bata siguro, ayaw pumasok sa school.
Actually, kasi syempre, hindi na, di ba, media plays also a role. Syempre, marami silang napapanood. And then they na parang just to get the attention of their parents, or they go into parang fits, Well, for one, kasi malalaman mo kung ito ay fake, depende sa klase ng pinapakita nilang movement, So, tapos, syempre, like I mentioned earlier, kadalasan kasi sa kanila, sa totoong klase ng, kasi ang ginagaya lang naman nila usually talaga is generalized tonic-clonic, So, there are, na pwede mong ma-distinguish siya, so, sa fake o hindi. Pero mas mabuti pa rin ikonsulta. Kasi alam nyo, malaking porsyento ng mga pasyenteng merong tinatawag nating pseudo-seizures are persons with epilepsy talaga.
Okay.
Because they have already experienced how it is to be taken care of when they have their attack. Parents usually shower them with a lot of attention. Pag medyo controlled na yung seizures nila, medyo binibigyan na ng konting freedom, binibigyan na tapos paminsan hindi na nila masyadong nakukuha yung gusto nila. So, ganun. Kunwari mag-seizure tayo.
That's true.
Pero Doc, ano naman
kaya be careful pa rin. Be careful pa rin.
So, na-label mo as pseudo lang.
Baka hindi na pala psudo.
Pero Doc, are there any diagnostic tests to confirm?
Epilepsy is a clinical diagnosis. Okay? So we base our diagnosis from the history of the patient, but there are ancillary procedures that we use, to help us in identifying if this would fall into epilepsy syndromes, more or less give us an idea where it's coming from, and ito yung isa dito yung tinatawag nating EEG o yung electroencephalograph, So, ito ay ginagawa natin kapag may suspetsa tayo ng ang pasyente ay may epilepsy. Meron din tayong video EEG. Kasi kaya nga gagaya sa mga pseudo seizures, kung masyadong close to an attack yung manifestation, or there are certain involuntary movements na hindi mo ma-distinguish totally if this is a partial seizure or is this any other form of a movement disorder, then meron tayong tinatawag ngayon na video EEG monitoring, where the patient, while having their EEGs, simultaneous yon na naka-video sila. Para if the patient goes into an event, i-correlate natin yun sa EEG findings nila to say, para malaman natin kung totoong atake ba talaga ito o hindi.
Actual seizure.
Kasi paminsan blank stares lang siya so hindi natin talaga totally ma-distinguish kung totoong ano ba to, hindi.
Okay.
Other procedures that will be possible that na maka-help us are mga neuroimaging, gaya ng MRI.
Ako talaga, doktora, personally, ang dami ko pang questions, especially sa mga bata.